Here at AACR 2020, we're presenting findings from our VirusScan study examining risk factors for cutaneous squamous cell carcinoma among a cohort of skin cancer screening patients at the University of South Florida Dermatology Clinic in Tampa, Florida. We all know that UV radiation is an established risk factor for squamous cell carcinoma. We also know that immunosuppression is also a risk factor for squamous cell carcinoma. And although there is some evidence that UV radiation can induce systemic immune suppression in animal models, the association between UV and SCC in the context of immunosuppression has been very little studied in humans to date. In this poster, we show that prospectively, recent UV exposure as measured through a spectrophotometer was associated with an increased incidence of squamous cell carcinoma in this study population. Furthermore, circulating T regulatory cells, or Tregs, were also associated with increased risk of squamous cell carcinoma, particularly those with immunosuppressive functions and those with skin homing properties, such as CLA-positive Tregs and CCR4 high Tregs. In fact, when we looked at the interaction, we showed that the association between UV and cutaneous squamous cell carcinoma was mediated in part through circulating levels of CCR4 high Tregs. Together, this evidence shows that UV may increase risk of squamous cell carcinoma through an immune pathway, and that these circulating markers could be used as a measure of risk stratification for personalized skin cancer screening regimens, as well as the development of novel chemoprevention agents.